Hello, I'm Dr. Heiner. In this video clip, I'm going to talk about prostate cancer treatment options. And these are options for men who have been diagnosed with prostate cancer and they've had a prostate biopsy with microscopic evidence of cancer on those biopsies. And in general, there's lots of treatments for prostate cancer, many of which are curative, and those include surgery to remove the prostate, radiation-based treatment options, which include external beam radiation to shoot x-rays through the skin into the prostate. There is something called brachytherapy, which involves the implantation of radioactive seeds or little metal pellets that look like grains of rice into the prostate, and those give off radiation within the prostate for 2 to 3 months. There's something else called high-dose rate brachytherapy, which is also radiation-based. There's something called cryotherapy, which involves insertion of needles through the skin into the prostate to kill the prostate and the prostate cancer with cold. Cold gases are run through the needles and it turns the prostate into ice. There's another treatment which is not FDA approved or available in the United States on a widespread basis, and that's called high-intensity focused ultrasound, or HIFU. That involves placing an ultrasound transducer into the rectum behind the prostate and sending ultrasound energy through the wall of the rectum into the prostate, where it focuses at such a high intensity that it kills prostate tissue with heat. So many patients will go to Canada or Mexico or the Bahamas or some other country for that treatment, which is widely available in all of the other countries except the United States. It's hoped that within a few years it will be available here in the United States, but we're not sure when that date will come. Those are the potentially curative treatment options for prostate cancer. Other treatment options include hormonally based therapies. Prostate cancer tends to feed off of the male hormone testosterone. So if the prostate cancer has spread to other parts of the body and we know we can't cure it with one of the other treatments that I mentioned, sometimes we can put people on hormonally based treatments that decrease their testosterone levels. Those could include surgical removal of the testicles, so there's no testosterone production. But more commonly, we use hormone shots, where every few months the patient who has prostate cancer gets a shot which chemically reduces the testosterone levels. Another important thing to discuss is the the watchful waiting or active surveillance management plans. Watchful waiting is typically something that's done with a man who we know has prostate cancer but might have a lot of other health issues or health problems and is likely to die of something else other than prostate cancer. And we know that we don't plan any intervention for the prostate cancer, and we just kind of watch and monitor and check the PSA blood tests at intervals to see how the prostate cancer is progressing. There's another management strategy called active surveillance, and it's similar. Some people will feel that although they know they have prostate cancer, they don't want to sign up for an aggressive treatment like surgery or radiation or cryotherapy, the freezing treatment, or high-intensity focused ultrasound. So they'll check their PSA at intervals, maybe every 3 to 6 months, and to see if their PSA is going up, with the plan that as long as the PSA stays stable, then they won't choose to have any intervention. People on this plan often, after a year or two, actually on the surveillance plan, every year or two will have another prostate biopsy to make sure that the prostate cancer hasn't turned into a more aggressive form of prostate cancer. Some prostate cancers don't make elevated levels of PSA, and so that is also part of the active surveillance strategy, is prostate biopsies at intervals. Some men, when they're trying to decide whether or not to have a prostate biopsy to find out if they have cancer, I think a couple of questions they should ask themselves are, number one, if I had prostate cancer, would I want to know about it? And number two, if I knew I had prostate cancer, would I want to do something about it? And the answers to those questions vary. If someone doesn't want to know they have prostate cancer or knows they wouldn't choose a treatment, then often I'll recommend that we not look too hard and not do a biopsy if it's not going to make a difference in what they do. Some men will say, if I had prostate cancer, I think I'd want to know about prostate cancer if I had it. And whether or not I want to do something about it might depend on how aggressive it is. So if it looks like a slow-growing cancer, maybe I would leave it alone. Why poke a skunk? That's how some people look at it. But if it was a faster-growing cancer or looked more aggressive, then maybe I would choose to have a treatment. But those are now, in general, for the prostate cancer treatments, the biggest side effects are effects on sexual function. It can hurt erections, or also effects on control of urination, urinary control and incontinence, because the prostate does form part of our urinary tract. And the pros and cons of all the different treatments is something you can investigate through the literature by reading or by discussion with your urologist or physician. And that's all for this video clip.